Hello, lovelies. Welcome to today's episode on Let's Talk Health. So, today we'll be talking about fibroids as this month is Fibroids Awareness Month. And yes, we'll be creating awareness. Today we are all advocates, so we'll be learning a bit about fibroids. And then at the end of the day, we'll have some knowledge to share with our family, friends, loved ones. So, let's get right into it. Globally, fibroid affects about 50% of women in their childbearing age, and some studies also suggest that about 77% of all women in their childbearing age may develop fibroids throughout, like once in their lifetime. And July has been dedicated as the month for fibroid awareness. So today we'll be talking a little bit about fibroids. Just a little presentation. You can share it at church, work, anywhere, just to advocate or create an awareness about fibroids. So, what are fibroids? Say fibroids are benign growths that develop in or around the uterus. This simply means that fibroids are non-cancerous growths. Yes, I know many people think that fibroid has something to do with cancer, but fibroids are non-cancerous growths. They have nothing to do with cancer. Another name for fibroids is myoma or leiomyomas. And fibroids vary a lot when it comes to their shape, their size, their pathophysiology. How pathophysiology means how they occur, how they develop. So how they develop, what caused them to develop, where they are located within or around the uterus, they vary extremely. And especially when it comes to the sizes, they can vary from the size of a pea, as tiny as a pea, to the size of a watermelon. They can vary like tiny, very tiny little, or can be as large as a watermelon. You also say fibroids usually occur due to discrepancies or inconsistencies in the hormonal cycle. That is the estrogen progesterone hormonal cycle of women. We also know that this estrogen progesterone hormonal cycle are responsible for a lot of things in women, from say sexual growth, sexual characteristics, um, even ability to reproduce, to get pregnant, have birth. All these things are affected by to have a normal menstrual cycle and all that. All these things are affected by the estrogen progesterone cycle. So this is what a normal uterus looks like. This is a uterus, normal one. This is a fallopian tube connected to our ovaries. This whitish thing here is the ovaries. As you can see, we have it on the other side too. Fallopian tube connected to the ovaries. And then these two are fibroid infested uteruses. As you can see, this one we have a white fibroid growing on top, like at the upper part of the fundus of the uterus. For layman term, we say on top, but in technical, medical, or nursing term, we say it's growing on at the fundus of the uterus. And then here we can see, if we look clearly, I said this is the fallopian tube. So imagine where this fibroid is. It has grown into the fallopian tubes, and this is a uterus with multiple fibroids. You have fibroids growing almost everywhere on every part of the uterus. There are different types of fibroids, like I said earlier, depending on where they are located and then what causes them to develop. We have about 4 different types of fibroids. We have first the intramural. The intramural is the ones that grow within the walls, the muscular walls of the uterus. So this one is growing right within the myometrium or the muscular walls of the uterus, and these are the intramural fibers. Then we have submucosal fibers. These are the submucosal fibers. They are growing right under the mucosal layer, which is the endometrium of the uterus, right under it. And then we have the subserosal. The subserosals are the ones that grow under the perimetrium of the uterus. You know the uterus have 3 different layers. We have the endometrium, myometrium, and then the perimetrium. So the subserosal fibers, they are growing just under the perimetrum. And then we have pedunculated. Unfortunately, in this picture, we cannot see the pedunculated fibroid, but pedunculated fibroid is like a fibroid that has a stem or a stalk attached to it. So unlike this one that are directly embedded into the various layers that they affect, the pedunculated fibroids have stalks or stems attached to them before they attach to any part of the uterus. So what are the risk factors or factors that can make someone develop fibroids? First, we can talk about age. We have early onset fibroids starting from age 30, but usually fibroids begin at age 40, or yes, from age 40 going. That's the median age or the mean age for fibroids to start developing in women. Also, fibroids is more common in black women than in white women. Some genetic mutations also predisposes some women to fibroids, put them at higher risk of developing fibroids. Then we can also talk about parity. Parity refers to the number of children you have or the number of times you have given birth. Now, we say that the higher the number of times you have given birth, the less likely you are to develop fibroids. So if you have a very low parity, or you are an elderly primate or an elderly nullip, that means you've never gotten pregnant or given birth before, you are at a higher risk of getting pregnant. The uterus is a bit funny because it can find work for itself if it doesn't get pregnant as it wishes. It can find work for itself. And then we also know that during pregnancy there are lots of hormonal changes and factors that come into play, and all these things can, and also as pregnancy progresses, a woman goes through normal labor and have the safe delivery for herself and her baby. All these things can help deal with fibroids that are not large or asymptomatic, fibroids that do not show any signs and symptoms. So depending on your parity, you could be at risk of getting fibroids, especially those with low parities but are elderly primates and elderly nullips. That means they have a high age around 35-40, but they have never gotten pregnant before, neither have they given birth before. They are at high risk of developing fibroid. Then we can also talk about hormonal changes or hormonal inconsistencies. As I said before, the estrogen progesterone hormonal cycle is really responsible for the development of some of these fibroids. We can also talk about obesity, sedentary lifestyle, and also diet. Some studies suggest that excessive intake of fat and red meat with less intake of fiber, fruits, and vegetables predisposes someone or puts a woman at risk of developing fibroids. So what are the signs and symptoms of uterine fibroids? First things first, let's take note of this. Not all fibroids show signs or symptoms. So not all fibroids will show any sign or symptom as most of us may think. Now that we know that, let's look at the signs and symptoms that some fibroids may show. First one, we can talk about heavy and prolonged menstrual bleeding that can further lead to anemia. And then also fibroids can cause enlargement of the uterus. This may lead to urinary symptoms and then GI symptoms. In normal pregnancy, as the uterus enlarges, it puts pressure on the bladder and also the rectum. So this pressure causes a lot of urinary symptoms, urinary incontinence, nocturia, urine retention, or frequency of micturition. It can also cause GI disturbance such as constipation or diarrhea. Also, fibroids can lead to abdominal distension and pain. Once again, let me gently remind all of us that not all fibroids show any signs or symptoms. Some fibroids are asymptomatic. So, and most women in the world right now who are having fibroids, but they don't know, because like I said, most fibroids are asymptomatic. They don't show any signs or symptoms. Okay, so how do we diagnose fibroids? Fibroids are diagnosed based on the presenting signs and symptoms, and the most common signs and symptoms of fibroid is heavy vaginal bleeding or heavy and prolonged menstrual bleeding and anemia. Yes, heavy prolonged menstrual bleeding leading to anemia and the rest. These are the most common signs. As we bleed prolongedly without being able to replenish the blood that we are losing during our heavy menstrual periods and the rest, the body will become anemic because iron stores will be depleted, red blood cells will amount of red blood cells in circulation will be reduced, even plasma level may be affected. So this prolonged heavy bleeding and unexplained anemia are usually the most common signs and symptoms, and this is what is mostly used to diagnose fibroids. So depending on the signs and symptoms, you'll be subjected to things like a scan, a pelvic scan, an MRI, some laparoscopies, examinations may be done just to see, or sometimes even the speculum vaginal examinations and the rest may be done just to see if there are any fibroid growths taking place or hiding within the uterus. So how does fibroids affect us? Do they have any effects on the body? Yes, fibroids can have a lot of effects on the human body or on the woman, starting with difficulties in conception, sometimes due to the sizes and then the positions of this fibroid. Imagine a fibroid that is protruding or blocking the fallopian tubes is going to cause things like ectopic pregnancy or even and also block implantation, so making pregnancy difficult. Fibroids can also lead to spontaneous abortions or miscarriage as they occupy as the fibroids continue to grow and occupy space in the uterus. Implantations or after fertilization may become difficult, and also as the fertilized embryo as the fertilized ovum or the embryo continues to grow, due to the presence of the fibroids, it may not get enough space to grow, so the uterus may be forced to push one of them out so that there can be space for one to grow. And then there's anemia, so as I explained earlier, the excessive bleeding will cause depletion of iron stores and low red blood cell counts in the body, which will lead to anemia. Fibroids can also lead to death if not treated, especially those who have experienced heavy bleeding as a result of heavy vaginal or menstrual bleeding as a result of fibroids. And then there is financial constraints or financial burdens. Treatment of fibroids require money and all that. And then there is also psychological burdens. Once someone becomes diagnosed with fibroids, you begin to think about fertility, how this is going to affect our womanhood in terms of reproduction, sexuality, and all that. It brings a lot of psychological burdens on the individual who has been diagnosed and also the family. So, as in some of the effects of fibroids on the body. Now, let's talk about treatment. So, the treatments for uterine fibroids will depend or is based on the type, the symptoms, and then the general health conditions of the patient. We have medical treatment, we have surgical treatment, and we have non-pharmacological or medical treatments too. So under the medical treatment, you can talk about hormonal contraceptives. Some of these hormonal contraceptives help regulate menstrual flow, blood flow, and also they have they come with some of these contraceptives comes with hematinics or blood supplements that helps increase the hemoglobin level in the blood after ovulation and all that. Then there is also tranexamic acid. Tranexamic acid helps in regulating coagulation and all that, reducing the blood flow, so this will help prevent those heavy blood flows. And then there is hormone therapy. Hormone therapy is different from hormonal contraceptives. This one we are talking about gonadotropins. These gonadotropins are growth hormones and sexual hormones, the synthetic versions of them that mimic the effects of the natural hormones, reducing their concentrations in the blood. As I said earlier in the other slides, that the estrogen progesterone cycle plays a role in the development of fibroids. So These hormones, artificial hormones, mimic the effects of estrogen and progesterone, reducing their natural side effects and also reducing the risk of developing fibroids. And then it's also anti-steroid, non-steroidal anti-inflammatory drugs or NSAIDs. This helps reduce pain and also reduce excessive blood flow or excessive blood flow. Then there is surgical therapies. We can talk about hysterectomy, myomectomy, uterine artery embolization, and then myolysis or myolysis, whichever way you want to pronounce it. So hysterectomy deals with removal of the uterus. Some people prefer that. They don't want to conserve the uterus again. They don't have any need for childbirth or that, so they may go for total hysterectomy. Some women may opt for myomectomy, which is removal of just the fibroids or the myomas and then preserving the uterus. And then there is uterine artery embolization. This is blocking of the uterine artery so that blood flow to the uterus will be reduced. When the blood flow to the uterus is reduced, these fibroids are not able to get enough blood supply, which will help them to grow, so they begin to shrink and possibly die off. And then myolysis or myolysis involves distraction of these tumors with high levels of specific energies like laser or radiation. So they target these tumors, these growths. I don't want to use the word tumors because that would be cancer. So they target these growths and then with those high level energies, being laser or radiations, to destroy them. So these are some treatment options. Let's look at some non-pharmacological treatment options. So non-medical treatment options, we have expectant therapy, then we have lifestyle, dietary, and then lifestyle modifications. And the expectant therapy, we can talk about observation. Now, what do I mean by observation? Expectant therapy is used for women with fibroids that are asymptomatic. Fibroids that does not show any signs and symptoms, that does not cause any pain, heavy bleeding, any form of bloating, any urinary incontinence, any GI disease. Fibroids that does not cause any problem for the woman. You can put such a woman on expectant therapy if only that woman is within the premenopausal age. Premenopausal age simply means that person is yet to reach menopause, and then that person is also yet to become pregnant, especially those elderly primates and nullips who are yet to become pregnant. They are the ones that we put them on expectant therapy. We observe them since their fibroids or the fibroids that are developing them are asymptomatic. We observe them. You don't put them on any medications or surgical treatments. You just observe them for the changes that will occur in their body. Then there is dietary and lifestyle modifications, eating properly, well-mixed diets, including vegetables, fruits, fibers in your diet, adequate intake of dairy foods, food made out of milk. Yes, dairy food, adequate intake of them, not excessive, just adequate intake of them. And also limiting intake of red meat. Limiting it, not stopping it, just limit it. Don't eat too much of it. They are not saying you should stop eating it altogether, no, but don't eat too much of it. These things are some non-medical treatments that can help in treating fibroids. So, some truths and misconceptions about fibroids. We all have truths and misconceptions about fibroids before we knew what they are. We all had truths, misconceptions, myths, and fears, and all that. So, the first one says fibroids are cancerous. No fibroid is cancerous. It is uncommon. Most fibroids are benign or non-cancerous. It is uncommon for fibroids to be cancerous. All fibroids cause pain. As I said, many women with fibroids are asymptomatic. They don't experience any symptoms because not every fibroid show any sign or symptoms. So many women with fibroids are asymptomatic. They don't show any sign or symptoms. Then we have says fibroids always require hysterectomy. That is not true. There are many treatment options which we just went through available, from medications to minimally invasive surgical procedures, and also even non-pharmacological treatments. that can be used to manage fibroids. So not every fibroid requires a hysterectomy. Fibroids causes infertility, which is not true. While fibroids can sometimes make it harder or difficult to get pregnant, or may have some effects of pregnancy, many women with fibroids still have successful pregnancies. Like I said, most women are having fibroid right now, but they don't know, because not every fibroid is asymptomatic. And yes, people have fibroid, but they still get pregnant and they have successful pregnancies and deliveries. Alright, that is it for today. That is our little presentation about fibroids, creating awareness. Since July is the Fibroids Awareness Month and we are creating awareness, these are some references for our academic people who would like to read more about this and then research more about this. So this video, I made it using a recorder that I saw in my PowerPoint app. I was just experimenting around. I've always been seeing that record option, but I have never tried it before. So I decided to try it today and then share with you guys. You can use it for your presentation. Maybe you are you have an emergency, be able to present in person and your professor is on you. You can do a recording like this. Your face is showing and everything background, so that you can send it to your professor or tutor, so that you don't miss out on your marks. And then even if you are presenting in person, you can still record a video using this recorder that I find in PowerPoint. You can still use it and then add some more value, flair and everything to your presentation to get more work, to get more marks from your professor. So for academic purposes or academic geniuses, you can use this. And also, if you want to make a presentation for school, maybe seminar at church, a little youth group presentation, peer group presentation, but you cannot be there in person, I think you can also use this recorder to try and record it and then share with everyone or anybody that you need to send it to. So that is it all for today. Thanks a lot, guys. This is an unedited version of this recording. This is what I'll be posting. I'll be sharing with you guys. So let me know in the comment section what you think about this presentation in general. You can drop in what's needed to be added that I omitted and what I need to omit from my next presentations. And also you can bring out more topics that you think we should do presentations on. Thank you.